Assalamu alaikum. Today I'm going to talk a bit about how to bracket or place a bracket in an orthodontic case. This is a composite that I normally use as the luting material for brackets. It's made in Germany. Heliosit orthodontic resin-based dental luting material for brackets. It's made by Ivoclar Vivadent. And try to buy something with good expiration date so you have plenty of time. We try to keep it in room temperature. Do not let it heat up too much or put it through freezing conditions. Today I'm going to use a molar tube as an example and try to place it right here on a typodont. This is a model to show patients what can go wrong with the teeth. So we can go through the process and determine how much material, how much of this composite luting material do you actually need on every bracket, and we'll go through with full placement. The amount you want to use should be very little. Here I'm covering about half or 1/3 the total base of a molar tube. In case of a regular tooth bracket, you should also be doing the same thing. Do not soak the whole thing up and do not put too much onto it, and that's the thickness of it. If you see in clear, it's not too much. The tooth must have been first cleaned, hopefully with piezoelectric instrument, to make sure that there is no plaque or tartar left onto the tooth. You have to ensure that the tooth is nicely clean and you have removed the pellicle, which is a protein layer stuck onto the teeth. If you're going to use a prophylactic paste to polish off the tooth, please make sure it does not contain any fluoride. In case you have fluoride in the prophy paste for polishing, it would impede the sticking of the composite resin to the tooth structure. So if I were to use any prophylaxis paste, it should be just pure pumice maybe, or totally fluoride free pumice or prophy paste. After you have etched the tooth, make sure you dry it, and I would etch the whole surface of the tooth to make sure everything is clean. So if this is a tooth we're trying to apply the bracket to, I would clean the whole surface of the tooth to make sure that there is nothing left from the pellicle or from plaque onto the tooth and everything is nicely etched. Then I would apply a coat of adhesive all over, making sure that the brush does not touch the gingiva so as to not contaminate the adhesive brush. Once the adhesive has been applied, I would go ahead and cure it, and that would seal the whole of the tooth structure all around the bracket. Although the bracket would take only a little bit of tooth structure surface coverage, I would like to seal the rest of the tooth structure with the adhesive, and I'll explain to you why a little bit further also. After the bracket has been placed onto the tooth structure, you want to make sure that the placement is right according to MBD system. We have to ensure on a molar particularly that from the cusp tips, the molar tube itself, the center of the molar tube should be 3.5 millimeter on a first molar. On a second molar, it should be at 3 millimeter to allow for the curve speed. Once the bracket has been placed, go ahead and cure it. In curing, please ensure that the tip of your curing unit should not touch the bracket. In case it ends up touching it, it might end up displacing the bracket into a new position and curing it thus. So keep this much of a distance between your light tip and the bracket that you're trying to cure. I would cure 5 seconds from one side and then about 5 seconds from the other side. You see, that would get even cure. So after 10 seconds, we can go on to the next phase. So here, I am now going to use a flowable composite along with a tip on it to secure my bracket even further. This is brand name FlowArt. You can use any which one, and the key is to go ahead and get better anchorage to the bracket that you are placing, and to ensure that the area around the bracket does not get decay due to the food impaction and the plaque buildup in that region. As the composite is squeezed and expressed, you want to ensure that you cover the base of the bracket as well as about 1 to 2 millimeter of the tooth structure beyond the bracket. Here I've only placed it in the distal part And once you have placed the composite and floored it, go ahead and cure it again for a few seconds, 5 seconds approximately. This will give a 10-second cure at the end. And this way, if you see, the distal is covered nicely and the tooth structure is also covered. This is the area where food would end up getting stuck and cause decay or white lesions on the tooth structure. So I always cover this up. It's kind of like a flat surface sealant for me till I'm ready to take the brackets off. Once I take the brackets off, I do not end up seeing any decay here, any white lesions, or any food impaction in this area. So you see here that the bracket base is fully covered with the flowable composite from all around, as well as the tooth structure about 1 to 1.5 millimeter all around is also covered with flowable composite. Once you are done with the orthodontic process or orthopedic process, it's very easy to remove this composite with a composite polishing burr. You do not want to use any diamonds on it because you do not want to cut away the enamel. I have seen cases here in which the dentists end up using diamond burr to smooth off the composite on the tooth after orthodontic therapy was done, and they ended up cutting all of the enamel. So this is what you do, cure it. It would allow you for very good anchorage, so the brackets won't come undone till you are ready to remove them. And you also have prevented the patient from getting decay around the bracket over the time period that you have the orthodontic process there. I hope that answers a few questions.